Hi guys, my name is Sarah Vonderhaar and I'm a part of Group 5. I will be discussing the first part of syphilis with you all. But before then, the things that we are going to talk about as a group are what is syphilis, research methods, description of syphilis, and then the terms and visual data. So to begin, we're going to start off with what is syphilis. According to WebMD 2017, syphilis is a highly contagious disease. It is spread primarily by sexual activity, including oral and anal sex. The disease can be contracted through kissing or bodily fluids. Syphilis is passed through open sores and wounds. Sometimes people aren't really aware that they have it, so there are definitely different stages of syphilis that we will be going over later in another slide. But to further this, mortality rates are that you mainly don't see them because syphilis really never gets to the tertiary stage of the condition. 8% to 58% of syphilis can result in death, but that's if the condition is left untreated. So in its earlier stages, if it is caught, it won't result to that. To go on further, morbidity rates, there are a number of new cases of syphilis each and every year. And in the United States in 2015, there were 9.6 new cases per 100,000 people, which is significant. We would like to see that number low, but is definitely small enough for 100,000 people. So it's in a good area as of right now. To further that even more, the economic outlook, there are more than 12 million Americans that are infected with a new STD each year. Therefore, sexually transmitted diseases are pricey and they're taking up a lot of America's money. That includes medications, treatments, proper care to deal with these diseases. So then the agent of syphilis is a bacteria. It has some big, long, fancy name. Syphilis is Treponemium pallidum. I totally just completely butchered that, but okay. It is a thin and enlonged bacterium that infects the body or body parts of a person. It is spreadable through sex, like I said before previously. Syphilis is treatable through taking antibiotics and further treatments depending on what stage of the condition the patient is in. The condition of syphilis, this is where I'm going to tell you about the stages and what to expect or at each stage. So what are the signs and symptoms of syphilis? You have your primary stage, which is single or multiple sores. You have your secondary stage, which is going to be rashes or mucous membranes on the skin. And then you have the latent stage, which is you don't really see any physical signs or symptoms. There are really no rashes or bumps on the skin. This is kind of hidden. This is where people come in and they don't see anything wrong with them, and they're really shocked and surprised at having this disease if they do. And then the tertiary stage is where it may cause heart and blood problems. This is where people may die and you may see mortality rates increase. This is very rare for America, but the treatment for syphilis in general is going to be a prescription drug called penicillin. It is an antibiotic and or a cream if you're having those mucous membranes on your skin and things like that. So if we move on, here's a few photos of the disease or the condition, infection itself. You have the bumps on the hands and the rash, and then you have it on the lips and around the mouth area, and then you continue to the right and you'll see more bumps on different parts of the body, the back, hands, feet. And then on the bottom left corner there is about 2 or 3 long membranes. This is what it looks like medically, biology, and biological terms, I guess you could say. And then further to the right is going to be a microscope of the condition and what it has to say. To further you guys even more, we'll continue. Thanks.
Hello everybody, my name is San Juana Saucedo. I'm a member of Group 5 with the topic syphilis. I will be talking about the modes of transmission, mechanisms and explanations, host factors, and environmental factors on my slides. To begin with, I would like to recap on what is syphilis. Like my group member Sarah already mentioned before, syphilis, its scientific name is Treponema pallidum, which is also known as the great imitator. It's known as a great imitator because it can take a form of a blister or a sore around the individual's mouth, or it can be found in the individual's genitals. Most of the time, syphilis is not recognizable, and it takes between 1 to 2 weeks for it to start showing the symptoms of the disease. Also, as mentioned before, syphilis is a sexually transmitted disease whose formal name is Treponema pallidum. Syphilis is a spiral-shaped bacterium with 10 to 20 coils that measures about 5 to 20 millimeters long and is only 0.1 to 0. millimeters wide. T. pallidum has no cellular membrane, and its only protection is 3 layers of rich molecules that include N-acetylmuriatic acid and N-acetylglucosamine acid, which makes it very easy to cure with the use of penicillin. Okay. Moving forward, the modes of transmission. Syphilis is transmitted through contact with a syphilis-infected sore during vaginal, anal, or oral sex. Furthermore, syphilis bacteria is known to be fragile, and transmission does not occur through contact in toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, shared clothing, or eating utensils. Syphilis can only be transmitted through infected humans. Until now, there is no other known form of transmission other than human to human. In many cases, syphilis has been transmitted due to the lack of knowledge of the infected individual, which means that the individual might not have known or have a clue that he or she might be the carrier of syphilis. Syphilis disease can occur in the early latent phase, and it's less common to spread syphilis during the late latent phase. This bacteria is also known to be passed on to the offspring by passing through the mother's placenta, and can cause, in many cases, a still death of the offspring or a miscarriage. And if the baby is born with symptoms of syphilis, it can be born with a lot of health problems, which can include deformation of bones or just the regular symptoms around the skin. As my partner had already explained to you on her pictures that she showed, how syphilis in a later stage can be seen or identified. As mentioned before, syphilis can only be transmitted human to human. Until now, there has not been any other potential host. And below, you're going to see a picture of how syphilis begins. Stage 1, from 3 to 90 days after the exposure. Stage 2, body rash, 4 to 10 weeks after the initial infection. Stage 3, it affects the internal organs, which this is 3 to 15 years after the initial infection. In many cases, this is usually where, if the female is affected, syphilis can be passed through on the offspring. Moving forward, the environmental factors. Syphilis is known to be common to dry, hot climates and to rural areas of poor economic status, education, and poor personal hygiene. The disease is most common source of transmission occurs when a skin or mucous membranes comes in contact with infected skin lesions. The following slide, it's just a graph that shows the total cases of syphilis broken down by race and ethnicity, explained by the Centers for Disease Control and Prevention.
Hello, my name is Jessica, and I'll be taking over the part of the temporal variation, the research article, the gap in knowledge, the further epidemiological research, and why our group deserves the $100 million. Starting with the temporal variation, China has been facing an emergent epidemic since the year of 2000 with an incidence rate of 64 per 100,000 to 32.9 per 100,000 in 2013. The incidence rate seems like it has lowered by half in 13 years, but still continues to be a problem. Reported cases have skyrocketed among gay bisexual men. More than 30% of the cases reported to be in early stages of syphilis. Incidence rates of 309 per 100,000 cases. There is a 2 to 5 risk of having HIV and being infected with syphilis. 40% of children are born to women with untreated syphilis infections, meaning that the mother can actually pass down the infection to the child when it's born. In 2015, there was a 67% increase of reported cases with syphilis. Continuing on with the research article that I chose was the immunological response to syphilis differing by HIV status. The study was done by the Institute of Tropical Medicine. This is an observational cohort study that has a sample size of 79 individuals diagnosed with HIV, and 44 of the individuals were in the first or second stage of syphilis. The participants were followed at a course of 3, 6, 9, and 12 months. The patients with HIV showed no symptoms of having syphilis, even though HIV did disrupt the natural course of the infection. It also provided a false positive result for the syphilis when diagnosed. The research did conclude that the study showed that neurosyphilis, which is an infection of the brain and spinal cord when chronic conditions of syphilis have expanded, can occur more frequently at an early stage and progress rapidly among patients with HIV. It also resulted in high inflammatory and anti-inflammatory cytokines, which is the 1L/10 level, which is the human cytokine synthesis inhibitory factor that is secreted by certain cells in the immune system that affect the rest of the cells in the body. Moving on to the gaps in knowledge, the research article did not mention the treatment for syphilis, so it didn't further explain what the patients were taking in order to treat syphilis. It also did not mention the third and latent stage of syphilis. It only focused on the first and second stage, so we clearly do not know how the body reacts to the last stages of syphilis when it's in most chronic condition. It also did not mention that how one is infected by syphilis. It didn't give further background information in that. It also didn't mention that patients with HIV were amongst the high risk. And it also did not mention that patients usually repeat cases of syphilis once they have been infected by it once. So a patient can have a reoccurring infected case again of syphilis after being exposed to it just once. Now, for further epidemiological research, I think that researchers should explain how syphilis is treated among HIV patients, and it also should elaborate on the treatments of syphilis. It also should explain how it affects pregnant women, especially when they are giving birth, and how the baby contracts the disease and it ends up affecting them in the long run. It also should explain the different types of testing to diagnose syphilis in order for a patient to be able to be given the right test in order to provide the better result. And also it should stage the different effects the stages of syphilis has on HIV and AIDS patients in order to be able to treat them and help them out with the infection.
Hello everybody, this is Pavani Tushara Garapati and I'll take the presentation forward for you. Further epidemiological research should have the ability to explain why certain outcomes occur, such as neurosyphilis, and be able to explain the disease condition in correlation to other comorbid factors such as HIV. Only when all the aspects of the disease condition are researched thoroughly can we think of methods to put these problems under check. Community-based participatory research, known as CBPR, is a framework epidemiologists can apply to their studies in order to gain a better understanding of the social context in which disease outcomes occur, while involving community partners in the research process and make sure the involvement is part of the research itself. CBPR promotes the field's ability to study and understand the complexity of the nature of the disease and its outcomes. Spatial analysis of health data could be another area to focus on in epidemiological research. It is a key element in understanding the distribution of the disease based on human behaviors and other factors. This type of analysis gives an insight into the areas that have a scope for improvement based upon which further policies can be developed. For example, based on spatial analysis, geographic locations with higher rates of morbidity and mortality can be analyzed, and further policies can be developed targeting specific populations. When the policies are made targeting smaller sections of the society, it becomes easier to monitor and check for results, thereby maximizing the effectiveness of the outcomes. In the primary and secondary syphilis rates of reported cases by race ethnicity in the United States, we can see that the blacks have had a higher rate of occurrence when compared to other ethnicities, followed by the NHOPI. If we look at the distribution of cases by sex and sexual behavior, we can see that men who have sex with only men are contributing to 54% of the cases, which is phenomenal. We have a pictographic representation of the rates of reported cases by the state in the United States. In this graph, we can see that there is a huge difference in the rate of occurrence of syphilis between homosexual and heterosexual behaviors. And also, the trend seems to be rising among gay and bisexual men.
Moving on to why our research deserves the $100 million. Syphilis deserves this money because of its incidence rates keep increasing and there are more reported cases occurring. Syphilis is likely to reoccur among those exposed to it, meaning treatment options aren't explained in great detail that patients do not follow directions properly. Syphilis can be easily confused as HPV because of the sores appearing in the genital areas. Furthermore, syphilis goes through different stages of infection, with each stage putting a different toll in the body. Not enough research has been done to see the actual effects of syphilis causing in the body. Lastly, syphilis is not a topic mentioned in STI education that many do not have knowledge of the disease. Preventable measures need to be taken, and the $100 million will help the research expand to lower the incidence rates of the disease.
Based on the numbers we have seen so far, despite the many prevention strategies, syphilis affects a considerable part of the population and is facing a rising trend among the homosexual community. This indicates the need for funding, and we suggest our group receives the donation. The presented information clearly indicates the gap in the information available and requires further epidemiological research to keep syphilis under check.